Aisha asks, what other diseases have the potential of becoming a pandemic, and how can we improve our pandemic response? As far as other pathogens that can become a pandemic, it's a long list of things, but as a general rule, you're looking at respiratory viruses more than pathogens that might be transmitted by a mosquito, for example. Because you can deal with the vector of a mosquito, perhaps. But if a respiratory virus like a flu virus or a coronavirus like this starts to become very transmissible and lethal, those are really the ingredients for a pandemic. There's so many ways that we can be prepared, starting from the very basic idea of identifying potential pathogens that are making the jump from animals to humans at that level, being able to identify those very early. Making sure you have good public health systems in place so that when people are showing up sick at a hospital or a clinic with something unusual, that can right away be identified, the virus can be sequenced, and we can start to even think about making therapeutics and vaccines very early. There's a lot of ways to become pandemic proof, as various public health experts have told me, but that's an example of a couple of them, really trying to be preventive in terms of thinking about this pandemic. Andrew asks, how likely is it that masks will become the norm during the wintertime? Well, Andrew, I don't know. It's funny. I look a lot at what happened in Hong Kong, for example, after SARS. Many countries in Asia are mask-wearing countries, and that culture developed for different reasons. But in Hong Kong, that was a place that was hit really hard by SARS. This is back in 2003, 2004. And they weren't really a mask-wearing culture before that. Other Asian countries were, but not so much in Hong Kong. Because of what happened with SARS, I think they became much more of a mask-wearing country. And as soon as this pandemic started to take root, Hong Kong immediately started implementing masks, and culture was so accepting of it that people did it almost instantaneously, and it probably helped a lot. I think there's going to be masks in this country. We really weren't a mask-wearing country. I think we're going to see a lot more of that now into perpetuity. In the winter months when flu virus is circulating, you might see a lot more masks, and we know that they can be effective because as much as the masks helped people who were wearing masks got protection against COVID and helped protect others from COVID, it also brought flu numbers down as well. So I think we're going to see a behavioral shift. It's not going to be widely prevalent, I don't think, but you will see people wearing masks, and that's likely to go up at times when respiratory viruses are circulating.